Although the doctor's office is the last place you would want to experience discrimination, healthcare providers experience implicit bias like most people in the country. Dr. Knox Todd, a physician at UCLA Medical Center, conducted a study where he asked the question, when a patient comes in with a broken arm or leg, does the patient's ethnicity affect whether or not they receive pain medication? What Dr. Todd found was that over a period of a year, more than half of all Latino patients treated at UCLA did not receive pain medication that they deserved, while only a quarter of the whites did not receive their pain medication. Dr. Todd took into account what time the patient entered the emergency room, time spent in the emergency room, whether or not they spoke English, the patient's gender, and whether they got injured on the job or not. Dr. Todd found that whether or not a patient received pain medication was mainly predicted on whether or not the patient was Latino. After his study, he then moved to Emory University, where he asked the same questions. Here, he found that African Americans were less likely to receive pain medication for a broken leg or arm than whites in the emergency room. One patient shared her experience where she felt discriminated against in the ER. She had a medical condition that made her feel excruciating pain. The patient went on to explain how the emergency room staff did not treat her the way she deserved. She went on to quote, "They treated me like I was trying to play them, like I was just trying to get pain meds out of them. They didn't try to make any diagnosis to help me at all. They couldn't get rid of me fast enough." End quote. The patient was a middle-aged, church-going lady with no history of substance abuse. She is certain her experience in the emergency room was because she was Black. As disappointing as it is, the woman may be correct. Minority groups in the states experience higher morbidity and mortality rates when compared to the white population. David Williams, a professor of public health and African American studies, explains that discrimination isn't always a calculated act. Instead, it is usually based on the person and the society around them and how they were raised. This all relates back to implicit bias. Implicit bias, also known as social cognition, is the attitude one possesses that unconsciously affects our understanding, actions, and our decisions. Now, because implicit bias is not accessible through introspection, meaning one cannot analyze their bias through their own mental or emotional process, it is hard for us to recognize when we are taking action. Implicit bias can influence someone to view another person in a positive or negative light. For example, one might feel more trust towards a white male walking down the street compared to an African American male. Of course, these responses aren't activated without the individual's awareness. The good news is we can change this. These implicit associations we have formed can be reversed by debiasing techniques. For example, the first step we can take is develop awareness of bias. Once we realize expressing a certain bias towards a race, we are able to make the steps to be more conscious of our actions. Second, improve the way you present information. If we are more positive in our delivery and the outlook of others, we can change our own outlook as well as the people around us. Third, slow down your reasoning process. It's easy to jump to conclusions, but once we take a step back, we are able to come to a clearer understanding. Fourth, change incentives. Once we are motivated to change these implicit associations, we are more likely to change ourselves. Lastly, we need to talk about race more and how it affects us. When we fail to talk about these situations, the topic becomes more tense. Dr. Martin Luther King quotes, "People fail to get along because they fear each other. They fear each other because they don't know each other. They don't know each other because they don't have communication with each other." End quote. Although we may not see change immediately, if given a decade or two, we will begin to see racial disparities dwindle in the healthcare. Now we are even seeing the death rate gap between African Americans and the white population shrink. For example, we have seen this gap drop from 33% in 1999 to 16% in 2015.